When looking at the human brain, I'm sure you guys have noted hills and valleys. Well, each hill is called a gyrus and each valley is called a sulcus. And in plural, hills are gyri and valleys are called sulci. Polymicrogyria basically means there are too many hills, meaning polygyria and micro because they're really, really small to look at. Basically, this translates to too many small hills. So instead of the standard hills and valleys of a brain, people with polymicrogyria have way too many of the hills. Essentially, this is an error in the way your brain folds and develops in utero. The cause of this is unclear, but there are a lot of genetic syndromes that go along with polymicrogyria. Sometimes this is related to congenital infections of the fetus or the mom while the baby is in utero. This could be related to syphilis, varicella zoster virus, or cytomegalovirus. The diagnosis is made with an MRI, and usually the diagnosis is made because unfortunately the child or the baby does not meet its milestones. There's a lot of cognitive delay, and so a whole workup begins, and then the MRI is obtained, and polymicrogyria might be visible. In addition to developmental problems, these patients might also present with seizures. Unfortunately, like most things with the brain, once you're born with it, there's really no treatment to reverse it. If you're having seizures because of this, there can be surgical options to take that part of the brain out to keep the seizures from getting worse. But aside from that, the treatment is usually with anti-seizure medications, speech therapy, physical and occupational therapies. I will add that there have been more than 30 genes associated with polymicrogyria. So if you already have a baby with this, I think it's reasonable to get genetics involved, do a genetic consult if you're planning on having more kids.